You've probably noticed it takes a little longer to get warm in the morning than it used to. Your hands, your feet, maybe you stand up and the room tilts for half a second before it settles. Not dramatic, just different. And you've started wondering if that's just what 60 looks like now. Here's the thing: you've been told the fix for basically everything is drink more water. And it's not wrong exactly. My guest today spends his career staring at blood flow under a microscope, literally. He's a reconstructive surgeon who has to get blood into tissue that's been surgically detached and reattached somewhere else on the body, and if the blood flow isn't right, the tissue just doesn't survive. He's going to tell us what he's learned about circulation from that work, and why he thinks a lot of people over 60 are drinking plenty of water and still not solving the actual problem. Please welcome Dr. Charles Garramone, board-certified plastic and reconstructive surgeon, 28 years in practice, specializing in microsurgical flap reconstruction, which is exactly the kind of surgery where blood flow is the whole ballgame. If anyone spent their career obsessing over whether tissue is actually getting fed, it's him. Dr. Garramone, welcome.
Thanks for having me. And I'll say up front, I'm not a cardiologist, I'm not a nephrologist, I'm a surgeon. What I know from the operating room, not from a lab studying aging populations. So take it in that spirit.
I appreciate you saying that outright. Before we get into it, drop in the comments what your hands and feet actually feel like most mornings lately. Warm right away? Take a while? That's going to matter for what we talk about today. So let's start broad. Everyone over 50 has been told, drink more water for basically every complaint under the sun. Where does that advice actually fall short?
So here's the thing about water, plain water, on its own. Your blood is mostly water, but it's not just water. It's water plus a specific concentration of minerals, mainly sodium and potassium, that your body works very hard to keep within a narrow range. Think of it like a construction site. Water is the truck. But if the truck shows up without cement in the mix, you don't actually get a wall built, you just get a wet spot on the ground. When you drink a big glass of plain water without enough of those minerals alongside it, especially on an empty stomach, your body actually has to work to keep your blood's mineral concentration in range. And one way it does that is by moving that water out of your bloodstream fairly quickly, into your cells or out through your kidneys, rather than keeping it in circulation where it can help maintain your blood volume.
Wait, so drinking water can make you retain less of it in your bloodstream, not more?
In a sense, yes, if it's not accompanied by the minerals your blood needs to hold on to it. The water isn't wasted, your cells still get it, but if your goal is blood volume and circulation specifically, plain water in isolation isn't the most direct route.
Okay, so what does that actually mean for a 65-year-old whose hands are cold in the morning?
This is where it connects to something very specific that happens with age. And this part I do feel confident about because I see the downstream version of it in wound healing constantly. As people get older, total blood volume, the actual amount of fluid circulating in your vessels, tends to run a bit lower than it did at 30 or 40. Kidneys become somewhat less efficient at conserving sodium. Thirst signaling gets blunter, so people drink less overall. And the net effect is that a lot of people in their 60s and 70s are running what I'd call quietly low blood volume. Not dangerously low, just lower than the system was designed around. And when blood volume runs a little low, the body prioritizes it keeps the core organs well perfused, and it's willing to shortchange the periphery. Hands, feet, skin. That's not a guess on my part, that's literally the mechanism I have to fight against in surgery, just in a more extreme, localized version. The body deprioritizes the periphery first.
That's wild. So cold hands in your 60s might genuinely be your body triaging blood flow, not just getting older as some vague thing. Right, and that's the tension beat I'd push back on. You're just getting older is true in the sense that the mechanism becomes more common with age, but it's not some mystical, unavoidable decline. It's a fairly mechanical fluid and mineral balance issue in a meaningful subset of people, and it's one of the more fixable ones compared to a lot of what actually is just aging.
All right, but you're a plastic surgeon. Why should we be taking blood flow advice from you specifically and not, say, a cardiologist? Fair question, and I'd rather answer it directly than dodge it. A cardiologist is the right person for your heart's pumping function, your blood pressure medication, your arterial disease risk. That's not my lane, and I want to be clear, I'm not replacing that conversation. What I do have that a lot of cardiologists don't get in their day-to-day is a very hands-on, visual relationship with what actually happens to tissue when perfusion blood flow reaching the tissue is borderline. I move tissue with its blood supply, sew the vessels back together, and then I watch in real time whether the color comes back pink and stays pink or goes pale and dusky. That's about as direct a relationship with blood flow as a doctor can have. It's just at the tissue level, not the whole cardiovascular system level. So think of me as the person who can tell you what underfed tissue looks like and behaves like, not the person managing your blood pressure.
That's a fair distinction, and I think listeners will appreciate you drawing the line yourself rather than us pretending you're something you're not. So walk us through it. What's the actual thing you'd tell someone to change?
The thing I've come to believe from watching tissue perfusion up close for almost 3 decades is that a lot of people over 60 would do better adding a small, specific amount of sodium and potassium into their fluid intake, not instead of water, alongside it, rather than just drinking more plain water and assuming that solves it.
Okay, hold on. Isn't that the exact opposite of what every doctor tells people our age? Watch your sodium, cut the salt. That's been drilled into everyone for decades.
And that advice is correct for a specific, very important group of people: anyone with hypertension that's sodium sensitive, anyone with heart failure, anyone with kidney disease that limits how well they clear sodium and fluid. For those people, what I'm describing would be actively wrong, potentially dangerous, and I want to say that as plainly as I can. This is not a blanket everyone should salt their water claim. But for someone without those specific conditions, who's otherwise healthy, who's just noticing the cold hands, slow to get going, mild lightheaded standing up pattern, a modest amount of electrolytes alongside water, is a very different intervention than the too much sodium raises blood pressure warning that's aimed at a different population with a different risk profile.
This is that economic framing you mentioned before we started. There's no 15-minute appointment slot built for explaining which category you're actually in, so the blanket advice gets handed to everybody the same way.
Exactly. It's not that anyone's hiding something. It's that cut your sodium is a safe, simple, broadly applicable message for a population where the risk of getting it wrong in one direction is much higher than the risk of getting it wrong in the other. But it does mean a healthy 68-year-old without those conditions sometimes gets swept into advice that wasn't really written with them in mind.
Okay, so practically speaking, what would you actually tell someone to do, starting tomorrow morning?
First thing in the morning, before coffee, before anything else, a full glass of water, but with a small pinch of salt and something with potassium in it, like a splash of orange juice or a slice of citrus squeezed in. You're not trying to make it taste like the ocean. It should taste barely different from plain water. Maybe faintly savory if you really pay attention. If it tastes salty, you've overdone it. The reason morning specifically matters is that you've gone 6, 7, 8 hours without any fluid intake overnight. And that's exactly the window where blood volume runs lowest and orthostatic symptoms, that lightheaded feeling when you stand up too fast, caused by blood pressure not adjusting quickly enough to gravity, are most common. So you're front-loading the fix right into the window where the problem is worst.
What does that actually feel like if it's working? Because add electrolytes is easy to say and hard to picture.
Give it a week, consistently. What people report, and I want to be careful, this is what patients and colleagues have told me anecdotally, not a measured study, is that the first thing to change is usually the lightheadedness when standing, because that's the most blood volume sensitive symptom there is. The cold hands and feet tend to take longer, more like 2 to 3 weeks, because peripheral circulation is the last thing the body restores, same as it's the first thing deprioritized.
So to recap that, round plain water alone doesn't necessarily stay in your bloodstream where you need it. Low blood volume becomes more common after 60 because of blunted thirst and less efficient kidneys. And a small specific amount of sodium and potassium alongside your morning water can help, but only for people without hypertension, heart failure, or kidney disease, where that advice doesn't apply. Before we keep going, if nobody's ever actually explained to you why your hands run cold or why standing up too fast makes the room tilt, hit subscribe, because this is exactly the kind of thing we dig into every week, the actual mechanism instead of the surface level advice. If you've got a parent, a spouse, anyone in your life dealing with that exact cold hands, dizzy on standing pattern, send them this episode. And if you've got a question for Dr. Garramone that we haven't covered yet, drop it in the comments right now. We genuinely pull from these for future episodes, and yours might be the one he answers next. All right, is there a way to actually tell if this is something you need, or if you're already fine and this doesn't apply to you?
There's a rough, low-tech way to get a sense of it, though I want to frame it as a general awareness tool, not a diagnostic test if you have any real concern. A blood pressure check with your own doctor, standing versus sitting, is the actual answer. But informally, stand up after sitting for a while and pay attention to whether you get a few seconds of lightheadedness or grayed out vision before it clears. If that happens most days, that's a reasonable signal that blood volume or blood pressure regulation on standing is part of your picture. If it basically never happens, this particular intervention may not be solving a problem you actually have.
That's such a useful reframe. This isn't everyone over 60 needs to do this. It's here's a specific symptom pattern and here's what might be behind it.
Right, and I'd rather someone walk away knowing whether this applies to them than walk away thinking it's a universal fix, because it isn't.
This actually connects back to what you said earlier about the construction site analogy. The water's the truck, the minerals are the cement, because now we're talking about how to tell if the wall's actually getting built or not.
That's a good way to put it, yeah. The standing up test is basically checking whether the wall's holding.
Now, before we get to the last stretch here, I have to say, the thing that surprised me most in this conversation is that drink more water being incomplete advice isn't some fringe idea. It's really just about mineral concentration and blood volume, mechanisms you'd recognize from basic physiology if anyone ever laid it out plainly. You've already gotten more out of this 10 minutes than most people get out of a year of drink 8 glasses a day. And next, I want to ask Dr. Garramone something a little more skeptical because I have to imagine there's a wrong way to do all of this, and I want to know exactly where that line is. So is there a wrong way to do this? Where does this go from helpful morning habit to actually not a good idea?
Absolutely, and I want to be very direct here rather than soft pedal it. This is not appropriate, full stop, for anyone with diagnosed hypertension that their doctor is actively managing with a sodium-restricted diet. Anyone with congestive heart failure, where extra sodium and fluid retention is specifically what their treatment is trying to avoid. And anyone with chronic kidney disease, where the kidneys may not clear excess sodium and potassium the way a healthy kidney would. And elevated potassium in someone with reduced kidney function can affect heart rhythm, which is a real risk, not a theoretical one. If any of that describes you, this conversation doesn't apply to you the way I've described it. And the right move is to ask your own doctor, not to follow a podcast.
I really appreciate you naming that specifically, instead of just saying, check with your doctor, as a throwaway line.
It matters to me that people hear the actual reason, not just the disclaimer.
Okay, let's bring this home. If you're 65 and you've been chalking up cold hands, slow mornings, or that dizzy half second when you stand up to just getting older, the thing you're actually trying to avoid isn't the cold hands themselves, it's what that pattern can lead to. An unsteady moment on the stairs, a fall risk that starts as, I got lightheaded for a second, which is exactly the kind of thing that turns into a hip fracture and a loss of independence for people in this age range. That's the real stake here.
If there's one thing I want people to remember from today, it's that plain water and blood volume are not the same thing. And for a lot of people over 60, the gap between them is smaller and more fixable than they've been led to believe. But it is genuinely not the right move for everyone, and knowing which group you're in matters more than the habit itself.
All right, starting this week, here's what to actually do. 1. First thing tomorrow morning, before coffee, a glass of water with a small pinch of salt and a splash of citrus or juice for potassium, barely savory, not salty. 2. Do that daily for at least a week before judging whether it's doing anything. 3. Pay attention specifically to the standing up lightheadedness in the first week and the cold hands pattern over 2 to 3 weeks, since they change on different timelines. 4, and this is the one people usually haven't heard, keep a small glass of water by the bed and take a few sips before you actually get up in the morning, not after, since a lot of the lightheadedness happens in that first 30 seconds of standing, and preloading a little fluid before you're vertical takes the edge off that specific window. 5. If you're on blood pressure medication, a diuretic, or have any kidney or heart condition, talk to your own doctor before changing anything about your sodium intake. This isn't a substitute for that conversation. It's a starting point for having it.
And I'll add the specific caveat directly if you have congestive heart failure, chronic kidney disease, or hypertension being managed with a sodium-restricted diet. Please do not add sodium to your fluids without your prescribing doctor's involvement. In those specific conditions, added sodium and potassium can worsen fluid retention, or, in the case of reduced kidney function, raise blood potassium to levels that affect heart rhythm. That's not a generic disclaimer, that's the actual risk.
You can find more on the physiology we talked about today in the show notes. Next time, I want to get into something Dr. Garramone mentioned almost in passing today, why peripheral circulation is the last thing the body restores and the first thing it sacrifices, and what that actually means for wound healing and skin after 60, since that's closer to his actual specialty, and I think it's going to reframe a few more things people assume are just aging. Before we go, drop in the comments whether you've actually had that lightheaded on standing moment, and if so, how often? And if there's something about circulation, healing, or aging skin you want Dr. Garramone to tackle next, put it in the comments now. We're building the next episode's questions directly from what you ask. Dr. Charles Garramone, board-certified plastic and reconstructive surgeon, thank you for being so direct today, including about where your own expertise stops. That's rarer than it should be, and it made this a much more useful conversation.
Thanks for having me. Happy to come back and get into the skin and healing side of this next time.